So, we have a patient here who has right lateral knee pain. His patella, which is his kneecap, is tracking laterally. It's laterally displaced on the x-ray. So there's a couple things that we can do. We're not going to show you everything here, but one of the things we can do is we can kind of open up and stretch his IT band. All right, so the IT band right here, all right, if it's very tight, can affect that, okay? So we would want to do some stretching of the IT band. The other thing we can do is line your back. We can use our hand to take the kneecap and push it from lateral to medial, from the outside to the inside. So we're kind of encouraging that kneecap to move more in. And we can also use assistive devices like the arthrostim here, so we can kind of use a gun to push it in. And then also sometimes to add to loosening up the outer quadricep, which would be the vastus lateralis, and also the IT band again. All right, turn that way one more time. I want to check behind here, so sometimes the lateral hamstrings, the biceps femoris. Okay, so we can get the attachment here on the outside of the knee, of the lateral hamstring. You could also stretch the hamstring, that would be good. And checking in here to the fibula head, that would be a good thing to look at. Now when he's on his back, face up. All right, so what I want to do now is I'm going to just check to see if he has movement from side to side in his knee, which he kind of does. So the tibia is moving. So sometimes the outside of the knee here, you're going to hold on for me there, and I'm going to try to just do some long axis distraction here to make sure the condyle of the femur and the tibial condyle can separate. And to stretch the hamstring, we can do this and have him push the knee into me, push down. 1, 2, 3, 4, 5, and then raise it up. Now push down. 1, 2, 3, 4, 5, and raise it up. All right. So the other thing you want to do is you want to always check to see if his calf muscle, the gastroc and the soleus. So the gastroc, we would have him push your toe towards the ceiling, push up, and come down this way. Good. Push up and come down, right? So then the other thing would be to stretch his soleus, which we have now. Push your toe towards me. Push, push, push. Now pull it up. Push, push, push. Now pull it up. Push, 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 and pull it up. Good. So these are some of the things that you could do if you have lateral knee pain. All right, and a lot of times that's due because the kneecap is pulled. Now, when the kneecap pulls this way, it also puts tension on the inside of the knee, okay? So we want to always check that too. So this is not by all means totally comprehensive, but this is one thing that you can do for people that have knee pain.